We're really excited about the changes in the cost of living adjustment for Social Security. Everyone's getting an 8.7% increase in January. Also some improvements to Medicare, but there's also some things that are increasing. So as you're making your plans for 2023, here's what you need to know. All right, let's begin as we talk about the 2023 changes with Original Medicare. Now, Original Medicare, of course, is broken up into two parts, A and B. A is pretty much everything that's going to be inpatient type services, and B is everything that's going to be outpatient type services, as well as all doctor services. So doctors that you would see in their office or they come to see in the hospital, surgeons, anesthesiologists, all the doctors are paid through the B of Medicare. Now, as far as changes go, when it comes to A, inpatient type hospitalization, we are eligible for Medicare Part A as long as we paid into the Medicare tax system for 40 quarters, which is basically 10 years worth of work. And as long as we have 40 quarters, 10 years worth of work paid into the Medicare tax system, then Medicare premium is zero for our entire lives. Now, there are sometimes people don't have their own 40 quarters, so we actually can get those 40 quarters of eligibility from someone else's work record. And that would be a spouse, and it could be someone you're married to presently, as long as you've been married for at least 1 year and that person's still alive, and they're at least eligible for Social Security. Don't have to be taking, but they have to be eligible. As long as they're 62 and they have 40 quarters, you actually can draw benefits off of that existing spouse. Now, if you're going to draw benefits off of an ex-spouse, here's the rules. You had to be married to that person for at least 10 years, and you could not have remarried prior to the age of 60. If we remarried prior to the age of 60, you can't draw from the ex-spouse. But as long as you're married 10 years, didn't remarry prior to the age of 60, then you can actually draw from that ex-spouse's work record for your Medicare A eligibility. Now, if you're married to someone and they died, as long as your marriage lasted at least 9 months and there was no remarriage prior to the age of 60, again, you can draw from that deceased spouse. So we're always looking for 40 quarters. And if we have those, zero premium for Medicare A. Now, for those people that don't have 40 quarters or who are working on getting those 40 quarters, there was one change for 2023, and that's this. So we're talking about a quarter. And keep this in mind. When we talk about a quarter, we can get no more than 4 quarters in a year, but we don't have to work the whole year to get 4 quarters because the quarter is tied to a dollar amount, and this is one of the changes for 2023. That quarter went to $1,640 of taxable income. This would be W-2 income or net self-employment income. So as long as we have $1,640 paid in, we would have picked up a quarter. So for the whole year, if we multiply that times 4, that would be 1, 24, 25, and 2. So that means as long as we made $6,560 in 2023, we will have picked up the 4 quarters. So those people that are close, that's what they're going to have to make in order to get to the 40 quarters. So that is the Medicare A changes. Now let's talk about Medicare B. Again, everything outpatient. Now to be eligible for Medicare B, again, we still have to have the 40 quarters, but it is not going to be zero premium. Medicare B, unless you're on 100% Medicaid, where the state pays for your Part B, you're going to pay a premium. And this is something that went down for 2023. Next year, the majority of people are going to be paying $164.90 a month for their Medicare Part B premium. For 2022, this was $170.10, so we're at $164.90 a month. Now, this is going to come out of your Social Security check if you're receiving Social Security benefits. If you're not, they'll bill you for that quarterly, or they'll set up some kind of a bank draft until you go on Social Security, so you don't have to pay quarterly. You can pay monthly through what is called Medicare Easy Pay. So again, this amount went down just a little bit from 22 to 23. Now, there is another thing to note about this. This Part B premium is always based upon what is called our modified adjusted gross income, which is basically your adjusted gross income on your tax returns. And if I'm on Medicare in 2023, they're going back at 2021. And so then they'll look back at 2021 modified adjusted gross. We got our AGI plus any kind of tax exempt interest income, typically municipal bonds, some U.S. savings bonds, foreign income that you did not pay federal taxes on, but you still have to report that on your returns. That is one line item on your tax return that's above the AGI, would be any kind of tax exempt interest income. And so they put those two together, and that's the number that determines what our Part B is going to be. Hey everybody, just real quick, I want to remind you to hit the subscribe button and ring the bell below. Just recently, I had a lady call me and she was scammed 3 times to switch her plans in 1 week just because she didn't have an education. We upload 3 videos every week, and our content is designed to give you the education that you need so you will not make those kind of mistakes. If you subscribe and ring the bell below, you'll never miss an upload. Hope you enjoy the rest of the video. And so about 90% of the population pays what we call our base premium, but about 10% of all people pay above that. And so that was another change in 2023, and that we call these the thresholds for IRMAs. So if I am, as a single filer, $97,000 modified adjusted gross income or less, I pay the $164.90. But if I am above that, then what happens? I am going to pay what's called an IRMA, and that's called an income-related monthly adjusted amount. Okay, and so this threshold actually went up, which is a good thing for 2023. Now, if you're a joint filer, married, filing a joint return, so here we have married, this amount went to $194,000 or less. Each of you would pay the $164.90. If we're going to be above that, then again, both of you are going to have IRMAs. And those on the low side are going to be around the neighborhood of about $75 to $80 a month, upwards to $500 a month if you're really, really high income. The whole point is Part B has a premium. Most people pay the base, but some people that are high income are going to have to pay more. And so again, these numbers adjusted going into 2023. Now, the second thing I want to look at as we look at the change over 2023 as it relates to original Medicare would be what we call the Medicare A and B gaps. The A and the B gaps. Now, Medicare A, as we talked about, is all inpatient type services as well as skilled nursing. So here's what changed for 2023 on the A side of Medicare. So what we have for this next year, 2023, we have an A deductible of $1,600. This went up a little bit. And this A deductible is our out-of-pocket expense if we go to the hospital, and this would be anything between 1 to 60 days in the hospital. So it doesn't matter whether you're in the hospital 1 day, 2 days, 30, 60, doesn't matter. Anything between 1 to 60 will cost you the same amount of money out of your pocket, and that's $1,600. That's the form of the A deductible. And then after that, Medicare pays 100%. And the bill literally could be $500,000, it could be $50,000, whatever it is, you pay $1,600. All right? Now, if I'm in the hospital longer than 60 consecutive days, it is pretty rare. It does happen, but rare. And we call these extended hospital stays. This is something else that happened. So day 61 to days 90, this number went up, and now we have what is a $400 a day copay every day for month 3. And then month 4 and month 5, so we have 91 days to 150. This number also went up, and now it's $800 a day copay. Again, these are extended stays. They are pretty rare, but when they happen, you can see they're pretty expensive. And then we also have a skilled nursing facility. So this is someone that has had a stroke, maybe a hip replacement, possibly an injury, accident, fall, and they have to go to fairly intensive rehab. So here's the rules. Medicare says days 1 to 20 cost you nothing as long as you were in the hospital a full 3 days or longer. So we have to be in the hospital 72 full hours or longer. Then the doctor can put us in skilled nursing for rehab. First 20 days is on Medicare. And then what changed for 2023 is days 21 to 100. Now we have a daily copay. And again, this also went up, and it is $200 a day. So Medicare pays the rest, but I have an obligation of $200 a day. And so my whole point is these are your gaps in original Medicare. And these also, of course, went up for 2023. Now let's talk about the B side of Medicare. All right? So the A side of Medicare, now the B side. And again, this is everything outpatient related, all doctor services, as well as durable medical equipment. This is the Medicare B deductible for 2023. This was in 2022 $233, so it went down just a few dollars. The good news about this deductible, it did go down, but also it's just once a year. This is a calendar year deductible. So if I start my Medicare in January, this is my annual deductible, very small. First $226 is out of your pocket. Then after that, we go into coinsurance. Now keep in mind that deductible is not prorated. So if I start my Medicare in July, I still have a deductible this year of $226 because every January this number resets. Sometimes it goes up, sometimes, as we saw this year, goes down a little bit. Now after we've met that small B deductible, then we go into coinsurance. Medicare pays 80%. And you pay 20%. This is called coinsurance. and that means it's your part of the bill. So when Medicare covers something, this would be for all your outpatient type services, your labs, your MRIs, your CAT scans, your cataract surgery, your knee replacements, anything outpatient, including all doctors that you go to see in their office or they come to see you in the hospital. That is your obligation, that 20%. And so that 20% didn't change. That's what it's been for years now. And then beyond the 20% coinsurance that is your responsibility, then we have this thing called an excess charge. And again, this didn't change. Excess charge is 15%. So this is when a doctor adds to the Medicare approved amount. Now, 90% of doctors take what Medicare amounts are set, meaning they take the Medicare reimbursement rates as payment in full. They'll just take this. Medicare pays 80, you pay 20. But some doctors add the 15%. And so Medicare doesn't pay any excess. They allow doctors to charge it, but when they do it, you have to pay that extra 15%. Okay, now there are 8 states in the country that do not allow excess, and so all the other 42 allow that. And so in New York, Connecticut, Vermont, Massachusetts, Minnesota, Ohio, Pennsylvania, and Rhode Island. Those are the 8 states that do not allow excess. And so if you're going to a physician in those 8 states, they can't add the 15%. Now, you may be, let's say, in Ohio and have to go to Mayo Clinic in Jacksonville, Florida. Well, they're going to add excess to that bill, or in Arizona. The whole point is in those states, they can't add it, but if you get care outside, that exclusion would not apply to you. Those other states can still add excess. And so, again, those are our 3 gaps on the B side of Medicare, and this is the one, of course, that changed. Now, here's what happens. The majority of people that stay in this original Medicare system do not like the liability of these gaps, so here's what they do. They will actually buy a Medicare supplemental plan. And again, I've got lots of training on this, but I do want to highlight just a couple quick things about supplemental plans. Now, for years and years and years, the top plan was the Medicare Supplemental Plan F, but they began to phase out the F plan, so here's the rules now. People can still buy the F plan, but they had to be born before January 1st, 1955, which meant they were eligible for Medicare prior to January 1, 2020. So anyone that's prior to those dates can still buy the F plan. Now, what the F plan does, it fills in all the gaps, which means it truly is a full coverage plan. As long as Medicare pays, that F plan will fill in all the gaps, except most people can't get it. Certainly can if they're born after 55, starting Medicare after January 1, 2020. All right, so, but that is the F plan. It's still available. Millions of people have those, and they will keep them the rest of their life. They're not going to lose them. They were grandfathered in before Medicare made the change. So what has replaced the F plan in popularity is the G plan, and obviously anyone born after January 1st, 55, starting Medicare after January 1, 2020, this would be the most popular plan today. And what the G plan does is it fills in 5 of the 6 gaps. Remember, F was full coverage. It filled in 6 of the 6 gaps, all 6 Medicare gaps. The G plan fills in 5. It covers everything on the A, deductible, copays, all this, covers excess, covers 20% coinsurance. It just doesn't cover the B deductible. So I would have to be out of pocket this year $226 if I were to get a G plan. Everything else would be covered. So Medicare pays. I only pay my B deductible once a year, and then I'm done. Now, again, we're a nationwide company. We're right in all the states. But just so you have a kind of feel for this, right now the average G plan across the country is going to be in the neighborhood of about $125 a month. Now, there are some that are higher, certainly some that are lower. I'm just saying this is kind of average. Someone turning 65 can get a G plan for $125 a month. So what are they doing? They're paying $125 a month to get these 5 of these 6 gaps covered, so they're only liable for that. All right, and so that's the G plan. Now, there is another plan that is not as popular as the G, but some people are buying as well. Last one I'm going to talk about, and that's called the N plan. Now, the N plan covers 4 of the 6 gaps. So what does it do? It covers 4 of the 6. So what it does, it covers everything on the A. So there's 3 gaps on the A. It doesn't cost you any money. Go to the hospital or skilled nursing facility at all. It will also cover the 20% coinsurance. It'll cover all, fully. But it won't cover the B deductible, just like the G didn't. and it will not cover the excess charges if and when that happens, all right? And so you'd be responsible for that. Plus what happens, not only that, every time I go to a doctor, I'm gonna have to have a $20 copay. I go to the emergency room, I'm gonna have a $50 copay. So what I'm doing on the end plan is I'm taking on just a little bit more liability. My premium's gonna go down. And again, folks, just to give me some average numbers, this is gonna be in the neighborhood of about $100 a month. So I'm gonna save about $300 a year, but again, I'm taking on a little bit more liability. Some are comfortable with that, and some are not. Again, that's a decision that you're gonna have to make. So as we move forward, I do want to you to be mindful of the fact that supplemental plans can go up, and they will go up. Medical inflation is a reality, and so we will see some price increases over time, of course. And what you want to do, though, is you want to pick a company that not only has a good initial premium, but also has proven to be very rate stable, because all companies go up, but some tend to take more frequent price increases and more drastic price increases. And so that's why we as a company always look back at the 10-year history of those price increases, because we think that's going to allow us then to make sure we know that we're dealing with a company that's been very price stable, and moving forward into the future will also be price stable as well. All right, so that's the way that's going to work. So those are the changes that are coming about in 2023 as it relates to A and B and supplemental plans. All right, that brings us then to Advantage plans. Half of all people today that are buying private health insurance stay in A and B and get a supplemental plan. The other half get what are called Advantage plans or replacement plans. These are also given the letter C, all right? And so when you look at your Medicare options, you really only have two ways to use your Medicare. You get A and B with a supplemental plan, or you get an Advantage plan. Now, the only thing that these two systems of coverage have in common is that you do have to be enrolled in A and B, right? So A had a 0 premium, B for most people this year costs $164.90. So that's the only thing original Medicare with a SUP and an Advantage plan have in common. Beyond that, they're totally different. And the reason for that is because of this. The first thing is Advantage plans are unique in that they have networks of providers. Those are called HMOs and those are called PPOs. All right? And so when you stay in original Medicare and get a supplemental plan, you don't have any network. You can actually go to any provider, any hospital, any doctor that takes Medicare. They will take your supplemental plan of choice, the company you chose, the letter that you chose. But when it comes to Advantage plans, it doesn't work that way. You're actually going to, for sure, going to have a network of providers, okay? And so the HMO networks are usually smaller, meaning not as many providers take the HMO. Now, plenty still do, but not as many as the PPO. And the reason for that is because, frankly, the HMO providers don't get paid as much as the PPO providers do. So some doctors are willing to be in both networks. Some may choose the PPO and not the HMO, and some may choose none of them. There are some doctors and even hospitals today don't take any of the Advantage plans whatsoever. They just don't want to work in that particular system. But again, when you take a Medicare Advantage plan, you are going to have networks. So as we move into 2023, if you're on an Advantage plan, that is something you had to pay attention to, because these networks do change from year to year. Why? Because an Advantage plan is nothing more than it's a one-year contract between Medicare, the insurance company, and the providers and you. And so that's the parties of that agreement. But again, everyone is just obligated during the year. And so as we move into 2023, some doctors would have been added to the network, some doctors came out. Some added hospitals, some came out. And so you always have to make sure you pay attention to what's happening with your plan, because again, it's just for 1 year. And so what happens is every year we're on one of these plans, we have the option to change those plans. And so if there's been a network change, then you may want to change your plan totally. And I'll explain that here in just a minute. So number one, when we look at Advantage plans, we have to pay our B premium, and we're enrolling into a plan that is going to have a network. Number two, big difference, is pre-authorizations. When you enroll in an Advantage plan, about 70% or so of the services that you are going to need are going to have to be pre-approved.
Hey, if you're looking for someone to help you hold your hand through this entire Medicare enrollment process, we would love to do that. Our team is standing by to help you. We help about 1,000 people a month go from Medicare confusion to having their plans enrolled, and it takes probably less than an hour. Go to the pinned comment below and you can book your appointment.
And that just simply means that the doctor says you need a knee replacement or hip replacement or an MRI or a CAT scan, or need to have some kind of an inpatient hospital stay. Those kinds of things have to be pre-approved. And that just simply means doc says, is this what you need? And then they send the pre-authorization paperwork into the Advantage plan, and they have to agree that you need that hip or knee or CAT scan, MRI, whatever the doc says you need. They have to agree and they have to approve it. Otherwise, they're not going to pay for it. And sometimes, frankly, they approve things immediately, but sometimes they delay approval. Sometimes they make you jump through a few extra requirements. For instance, usually when someone needs a knee replacement, depending upon the severity of that, of course, the Advantage plans say, no, we like to try medications first. We want steroid shots to the knee, or we want therapy for 9 months or some period of time. And so they can make those kind of requirements. That's a pre-authorization. And so you have to jump through a few hoops. Just because doctor says you need it doesn't mean you'll get it. The insurance company must agree with that. And again, sometimes they do immediately, but sometimes they delay it, or sometimes they just flat deny that. And so you have to be aware of that. Now, the difference is if I had original Medicare A and B and had a supplemental plan, I never have a pre-authorization, meaning that insurance company has no say-so whatsoever, because supplemental plans follow Medicare. If doc says you need it and Medicare says we'll cover it, end of story. It's on the schedule, it's done. And that supplemental plan has to pay if Medicare pays, based upon the letter, of course, that you purchased for your supplemental plan. Again, you have to be aware of that. All right. And then lastly, you also have to be aware of the fact that if you get an Advantage plan, it could become, may not become, but it could be your permanent plan. And the reason for that is this. In all but 4 states, and those states would be New York, Connecticut, Vermont, and Massachusetts. In those 4 states, you can actually get a supplemental plan anytime you want with no underwriting required. But in all of the other 46 states, if you take an Advantage plan, here's what's going to happen. Most Advantage plans, depending, and again, this is depending on when you started, but let's just keep it simple. And we know this happens in 46 states. If I start my A and B 1/1/2023, and I enroll into that Advantage plan, I have what's called a trial right. And during that year, anytime, any reason, if I decide I don't like my Advantage plan, I want to go back into the original Medicare and get a supplemental plan, I have the right to do that, and there will be no underwriting whatsoever. But if I am on that Advantage plan 1/1/2024, or longer into the future, so I kept it a year, 2, 3, 4, 5 years, whatever, we keep that, and now I want to leave Advantage and go back to original Medicare A and B, get a supplemental plan, then what has to happen? Now I have to be approved. I have to go through an underwriting process to make sure that I can get that policy, because now that insurance company, I'm beyond my trial right, now they don't have to take you. And so what happens after that 1 year, we're going to have to ask you about 30 health questions. We're going to check all your medications, maybe get a statement from your doctor, and that information is submitted to the underwriter with that supplemental company, and they may approve the case or they may deny the case, depending upon your pre-existing conditions, your health issues going on, everything else they're going to look at, and they're going to see if that's something that they want to write. And if they don't want to, they don't want to approve it, they're not required to do so. They must if you have a trial right. But beyond that, they do not have to, which means you could get on that Advantage plan and you stay on it a year, 2, 3, 4, 5 years. Now you won't get off of it if your health has changed and something's going on, rheumatoid arthritis, insulin-dependent diabetic that has complications, spinal stenosis, AFib, all kinds of things can happen. And now you cannot get approved to make that switch, and so you will have to stay on that Advantage plan permanently. Okay, and so those are the kind of issues. Now, when we talk about Advantage plans, what you have to realize is that Advantage plans almost always are a 0 premium plan. Okay, and as we move into 2023, that's the same thing applies. Many of the plans have 0 premium. I still paid Medicare, but I have to pay the insurance company anything. And the reason for that, instead of paying a premium, what I'm going to do is I'm going to pay copays. All right, so the copays in 2023, most of them have gone up. In fact, if you go to the hospital in 2023, it's going to cost you on the average about $325 a day. Okay, $325 a day to go to the hospital, and that's usually about 1 to day 6. So that hospitalization up to 6 days is going to cost you, what would that be? About $1,950, okay? If you have an MRI in 2023, that's going to cost you about $200. This would be a CAT scan, MRI, PET scan, those kinds of things. If you have to take an ambulance ride, that's going to be about $350 on average. And then if we have some kind of an outpatient procedure, that's going to cost on the average about $300. That would be a knee replacement, maybe cataract surgery, things like that. Now, the good news about all all these co-pays that I'm paying, they're going to stop eventually. And we call this your max out of pocket. And again, these did go up in 2023. Right now, the average is going to be about $5,000 max out of pocket in network. If I go out of my network, like on a PPO, it could be as high as $10,000. But what's happening is on my Advantage plan, I didn't have a premium, so I pay co-pays, copay, until I hit my max out of pocket for the year. Now that max out of pocket, you may reach that in July, may reach it in February, I may reach it in December, whatever. But whenever you reach that number, now you can put your checkbook away, put your wallet away. You're not going to spend any more out of pocket once you hit the max. And then that max out of pocket will reset in January. And then again, we start the process again, paying co-pays until we hit the max out of pocket. So again, we saw some increases into 2023. About the $5,000 is going to be average.